Hey guys, welcome back to the channel, Life After Accutane. This is a special early morning episode, transatlantic episode. Um, just to remind you, this is the channel that I created to share the negative stories of people affected by a drug known as Accutane, Roaccutane, or the generic name of Isotretinoin. If you like the video, give it a thumbs up. That helps to get it seen. Please subscribe to the channel also. And if you'd like to support the channel, please visit our Patreon page, which is patreon.com/lifeafteraccutane. The most common negative issues after taking Accutane are brain disorders, problems with the digestive system, joint pain, autoimmune diseases, permanent dry eyes, and sexual dysfunction. So for this video, I'm joined by Rachel from the US. Rachel, if you'd like to introduce yourself.
Sure. Hi, Tom. So happy to be on this channel. Yeah, my name's Rachel, Starbucks name at least. I'm from the US. And yeah, unfortunately, I also fell into the Accutane trap. And I'll explain why I think it's a trap. But just a brief introduction. I am approaching 30 and severely debilitated by the long-term effects of this drug and just iatrogenesis in general, but specifically very damaged by this medication that I took when I was much younger. So I used to be a very, very highly functioning type A, extremely athletic, high achieving individual, pre-vet or pre-med, thinking about going into veterinary school or medical school before I was severely injured by this drug. And I am still pretty disabled by it today.
Okay. I know you've already planned out what you want to say, but I've got a list of questions here. So firstly, how long ago did you take the drug?
I took the drug in 2013, so a while back.
Okay, and did your doctor give you any warnings before you got it?
My doctor really loves this drug, and he basically didn't want to give me any warnings about it because he feels that it's so safe. And this is something that to this day I think is completely absurd. I spoke with my doctor at length about my concerns with the drug, which I could either get into right now or I could get into that a little bit later on, whichever you prefer. But yeah, being someone who is very concerned about my health and someone who studied biology and someone who is just pretty risk adverse in general, I had a lot of concerns about the medication, which I spoke to my doctor at length with. And long story short, he dispelled each and every one of my concerns with pretty faulty information, which I now have realized after doing loads of research on the topic.
Okay, and how bad was your acne?
You know, at the time, I thought it was worse than it was. I would classify it as probably moderate cystic acne. The cysts were pretty deep and uncomfortable, but definitely not severe. I don't think anything is really severe enough to warrant a chemotherapeutic agent that literally changes your DNA and the way that your body works in a very serious way. Now knowing what I did not know then, I thought that my acne was serious enough to warrant it, but it definitely was not. My doctor also inflated the level of severity of my acne, as most dermatologists tend to do, in my experience.
How was your health before you started taking the drug?
So this is unlike some people who've taken the drug. My health was not completely pristine before I took the drug, but it was pretty darn good. I would say that I physically I was very healthy, and I had some residual issues from the HPV vaccination, which I'd had prior. I had a reaction to it, which I still believe I'm dealing with to this day, but the physical health problems that I've had did not start until after discontinuation of this drug. So I was physically incredibly healthy, never really got sick, strong as an ox, was able to do 2-finger pull-ups, and was a very highly athletic person in general before taking the drug.
Yeah, you mentioned that you used to do a lot of rock climbing.
Yeah, rock climbing was my favorite thing to do in the world. It was absolutely my hobby. I would train 1 to 3 hours a day often, biking frequently, mountain biking up to 60 miles sometimes. So rock climbing, mountain biking, yoga, backcountry skiing. I did a lot of pretty intensive physical activities. I was in quite good shape before and during the taking this medication.
Okay. And what kind of blood tests did you have
I
before,
had
during,
all
and
of the
after?
blood tests that were recommended. I had complete blood count, complete metabolic panel. Um, they even checked my CPK, I believe, which not all doctors check. They checked my liver enzymes. Everything was completely pristine my entire way through. And my doctor was commenting on how good my blood tests were. My triglycerides were very good and low. My cholesterol was great. Yeah, my doctor told me that, I was responding very well. Some patients have had to have their doses lowered due to heightened levels of liver enzymes, and I never had a single issue with that. So yeah, the blood tests are extremely misleading. They really do not have any ability to check your health while you're on this, or the chance that you might be having long-term damage in your organs or in other tissues of your body. There's really no way to check for that, except for maybe incredibly severe like rhabdomyolysis or complete liver destruction. Besides that, there's really no way to see how the drug is interacting with your tissues. So my blood tests were perfect.
Okay, yeah, that's kind of like what I covered with Edo when I did my interview
Exactly.
with him. There's no way of knowing which way it's going to go when you take this drug.
No, the blood tests are very misleading. In
Okay,
fact, I think it's almost like they do that on purpose. They give you this false promise that, as long as you don't get pregnant, they tell you not to get pregnant in about, 40 different ways. And it's a little, yeah, I think it's purposely a little bit of a detraction from the major issues that occur with this drug is, the liver damage and the pregnancy. These are things that people always talk about. And those things are supposedly easily avoided, but all these other issues that are swept under the rug are not at all.
yeah, and I think the reason why they go unreported is because doctors aren't taking them seriously.
Because doctors are completely oblivious to the research that exists, the large body of research that exists on retinoids. Many dermatologists are completely uneducated on this compound.
Okay, what was your dose?
So I was told that taking a low dose of the medication would keep me safe from any of the more serious effects that are dose dependent and they occur at much larger doses. In general, yes, of course, things are dose dependent. And if I had taken 80 milligrams, I probably would have died. But I took 20 milligrams is the highest that I took. And I started off at a very low dose of 10 milligrams. Now I know that there's no such thing really as a low dose of such a toxic compound. So 20 milligrams is not low, but it's still about a third of what other people of my weight range, which I was about 50 kilograms when I took it. So still, some people take 2 to 3 times or even more that amount. In fact, children with neuroblastoma take 5.33 milligrams per kilogram. So that is, depending on your dose, about 15 times the amount that's taken for Accutane patients for acne. So low dose is misleading. A lot of people have very serious injuries from a low dose. This is something that I'm working to speak out about.
Okay, yeah, my dose was 80 milligrams. I think I've mentioned that in other videos, but there's
Right.
still people being given that kind of dose.
Yeah.
It all seems to be dependent on your body's ability to detoxify the drug.
Yeah, exactly. And also just, numerous factors, your body's ability to detoxify the drug with your, the CYP liver enzymes and the interaction with, interacts with hundreds of different transcription factors on the DNA. None of these are anything that can actually be predicted at all. And so how it's going to interact with someone's DNA, someone's tissues, someone's liver metabolism, how it's going to break down into various different compounds is completely questionable. That's up to the individual. So there's a lot of variability.
Okay, and what side effects did you have while you were on it?
While I was on the medication, so this is another misleading aspect of this, of harm from this medication, is that many people develop incredibly severe, debilitating, lifelong, permanent side effects after they discontinue the medication, sometimes days, months, weeks, sometimes even years. So while I was on the medication, the side effects that I experienced were really nothing that my doctor felt any level of concern about. I experienced, of course, at first, started off on a very low dose to make sure that my body could handle it. I started off on 10 milligrams and I was on that dose for about 6 weeks. And during that time, I had nothing besides dry lips, slightly dry skin, not even peeling, just, a little bit dry here and there. Not too bad. And then I slowly transitioned just to be really, really cautious about everything. I very slowly transitioned to 20 milligrams, doing an alternating 10 to 20 milligrams for a couple of weeks. During that time, I still didn't really notice anything. And at some point, about 2.5 months into taking the medication, I noticed something, a reoccurring injury that I'd had from previous had started to flare up a little bit. So I guess this was when my first more serious side effect happened, but it was completely dismissed as a side effect related to isotretinoin because it was basically just that I was rock climbing in a crack in the wall. So kind of shoving my ankles, shoving my hands into a very narrow crack. It's called crack climbing. And as I was doing this, I shoved my ankle, twisted it, and I injured my ankle a little bit. So, pretty normal type of ankle strain. I noticed that my ankle was a little stiff and a little hard to walk on. I had a surgery on that ankle before, so it didn't seem to be concerning at the time. So, it had flared up. I'd had chronic ankle pain for many years in my life as a teenager. So it wasn't something that was a red flag to me immediately. I went to a doctor, a couple doctors have it check out, and they said it was related to sequelae of the surgery that I had in 2008. And so to me, that made sense. There was no indication that it was a systemic effect of the medication. And when I reported this to my dermatologist, he said that if it were related to the medication, that naturally the joint pain or the muscle pain would be a more systemic effect. So, it would primarily occur in my back, especially thoracic spine often. And I would just have overall joint achiness, which I did not have at all. It was just really limited to that one ankle. So, I had it checked out and did not seem to be concerning. So as the course progressed, I had been on 20 milligrams. I kept going and I started to, I have dealt with anxiety and depression previously in my life. Mentioning that because when I had anxiety and depression during my very rigorous course load at a university studying biology, it didn't really strike me as something completely out of the ordinary because it's pretty common um, for myself and for students to feel anxious and to feel depressed, and maybe I'd had some level of brain fog after the Gardasil HPV shot that I had, and that really caused some toxicity in my brain, which I struggled to recover from. So at the time, I wasn't really relating the two. It took a while to notice those things. So I experienced um, some level of anxiety and increased depression while I
Did,
was on the
did
medication.
you find the anxiety and depression that you experienced due to the Accutane was any different to the anxiety and depression you'd experienced previously? Did
Retrospectively, looking back, yes, it did seem to be different
yeah.
than the anxiety and depression. I mean, I would say it was not the worst anxiety and depression that I had in my life, because um, after my reaction to the Gardasil shot, I had a very severe brain fog, and I recovered from that to some degree. So it's not like it was anything that I've never experienced before, which is why it didn't strike me as something completely out of the ordinary and completely out of the question of the norm for me. So yeah, looking back in retrospect, it did have a different quality to it, but at the time, it didn't really strike me as being related to the medication. I reported this to my doctor, and he said, as long as you're not going psychotic or suicidal, then it's really nothing. Like he is under the impression that the drug doesn't even cause mental effects or depression at all, nor does it cause anxiety. He was sending me all of these literature reviews about how it doesn't cause depression or anxiety at all, which I now know is ridiculous. But yeah, so retrospectively, I would say that it was a little different, but during the time on the medication, it wasn't serious.
I think if everyone was honest, we've all experienced some sort of depression and anxiety in the
Yeah,
past. And
yeah,
in my early 20s, I experienced a little bit of depression and anxiety, but it was always in response to something. It was always due to something that
yeah.
was going on in my life.
Often
Whereas after
situational.
taking Accutane, it was more like my brain was malfunctioning.
Right. And I have, I've experienced my brain malfunction before from the reaction I had to the vaccine. So to
Yeah.
me, I at the time had a hard time distinguishing the difference between the normal circumstantial based anxiety versus something that was chemically induced. So looking
Yeah.
back, it had a different quality, but at the time it was very questionable and not seeming to be concerning.
I know the anxiety I've experienced after taking Accutane is just a constant rumination on thoughts and
Yeah,
intrusive thoughts, and it's
right.
just always there. You can't get rid of it. It's
Yeah,
not.
it damages your brain. It's brain damage.
Yeah.
That's what it is. So
Okay.
yeah,
So we've just touched on that slightly, but yeah, my next question was going to be, how was your mental health while taking it?
right.
So we
Yeah.
probably.
So yeah, I had a very stressful period of time while I was taking it. It was stressful for reasons in my life. It was one of my last quarters before graduating. I was working in um, I was doing some laboratory research and trying to teach undergraduate intro to cellular bio classes, and then I was working on my applications, and it was a very stressful period of time in my life. I was taking a lot of classes that were pretty stressful, and I had also been presented with the possibility that I might need to have another foot surgery because I'd had an issue in my ankle prior. So it was a stressful time in my life. So my mental health was not great, but it was difficult to distinguish the difference between what was medically and what was the medication inducing it and what was happening in my life. It wasn't really a clear cut answer at the time.
I think this is something that especially parents need to be aware of. You're giving
Yeah,
this drug to teenagers and young people when they're probably at one of the most stressful times of their life. You're
right.
then giving them a drug which is going to impair their brain function.
And that, yeah, and this is something that physicians are in complete denial of. Most of them are totally unaware of Doug Bremner's study that it reduces prefrontal cortex activity by about 21%. It inhibits neurogenesis. There are retinoid signaling pathways in the brain. I mean, in the membranes. It, dries out the membranes of the brain. Like, this drug affects the brain. And for some reason, even though vitamin A toxicity is universally recognized to cause brain issues, to cause psychosis, to cause lots of problems in polar explorers who accidentally ate too much polar bear liver. This is something that is widely accepted, and yet somehow, despite the wide body of evidence of research, dermatologists consistently seem to dismiss what is warned in the drug inserts about it affecting mental health. And when I spoke to my doctor, he said, "Oh, the research proves that Accutane doesn't actually cause depression, and it's a second variable because there's all these confounding factors, and because no acne causes depression, and then patients can't deal with the fact that they have residual trauma from their acne and they are then depressed because of that, or maybe it's a more depressive prone cohort of individuals because these people are young adults." And so they really, really try to pick at straws to hide and conceal the warnings about this drug literally causing damage and changes to the brain. And this is just an organized denial within the board of dermatology. And I found this to be consistent with so many doctors I've talked to. I've done a lot of research on this, speaking out to different dermatologists, and they all seem to disagree with they say, "Oh, well, it's a warning, and yeah, don't commit suicide on it, but I've never seen that happen. I've never seen depression related to this." And based on all my research, it's really common that it affects the brain.
And the human brain isn't fully developed until the age of 25 anyway.
Exactly.
Yeah, that
Yeah,
seems
so
to be
my
the general
brain, my
consensus.
brain was not developed at that point too. And then there's some kids, like 12-year-olds, who are put on this drug, which I think is just insane, borderline abusive, I would say.
Yeah,
Not, I'm sorry to all the parents who might find offense to that, and it's not the parents' fault. It is the dermatology, the board of dermatologists, who are in widespread denial about this.
and then above them, the pharmaceutical industry.
Yeah, but we all know pharmaceutical industry. Like, we expect pharmaceutical industries to be corrupt, right? But we believe that our physicians in white coats are these, we believe that they protect our health since they've been through so much medical training. So they are, as Ido had said in his video, they're supposed to be the gatekeepers of these dangerous substances. They're supposed to protect our health. So I would actually I'd blame the doctors even more. Like, I expect pharmaceutical companies to try to make money. That's not something that I would ever question.
Do you think there's an element of true ignorance, or do you think it's a willful ignorance?
So that's an interesting question to answer, because I strongly believe that the average dermatologist who prescribes this drug because they love this drug. They love this drug because it's effective. It's very effective. I believe.
It's the only tool they have. This is the
Yeah,
problem.
because they have a limited toolbox within their medical paradigm. And so, because they have something that is so effective at literally killing your sebaceous glands, so it works, right? So they love to use it. And I believe that because I come from a family of physicians. Maybe I should have mentioned this earlier. I come from a lineage of physicians. So I therefore strongly believe that the reason that I'd say maybe 95% of dermatologists prescribe this drug is not due to any not due to any ill intention, any malice at all. It's really just an inability to think for themselves, and complete ignorance, because many of them have just not gone above their training, above the limited training that they've had on this compound, to actually look at some of the thousands of articles that are written on the mechanisms of retinoids and the harm caused by retinoids. Many of them are completely unaware. They don't even look beyond the very few select cherry-picked articles that present the medication in a favorable light. So no, I don't think that the doctors have ill intent or malice. I wouldn't go to a doctor and say, oh, you're an evil person because you prescribed me this drug that ruined my life. I would say, you are a lazy and ignorant person because you are not withholding to the Hippocratic oath of protecting your patients, which includes informing yourself on the dangers of the medications that you're prescribing.
And giving your patient the necessary information to have informed consent.
Exactly. Informed consent. This is something that I was not given with this drug. I was not only not given informed consent, I was given incorrect information.
Yeah, I was specifically told, do not go online and research this medication.
They love to say that.
Yeah.
Almost every doctor I've talked to says, oh, it's such a shame that there's all this misinformation online. You shouldn't go online. They all say, they use these little sound bites that they like to say.
Well, actually, I should probably stress that in these videos. If you're thinking about taking this drug, if you've come here because you're thinking about taking this drug, do your own research, please.
Never, please, for the love of your own body, for the love of your child, for the love of your nephew, never, never, ever take a physician's word for anything involving your own health, because chances are they know far less than they lead you on to know. I know this because my father's a physician, and there's a lot that I thought he knew that he does not know. He doesn't even know how to report an adverse event from a medication. Having been in practice for over 30 years, this is something that they never taught him in medical school. They do not teach you about iatrogenic injuries or illnesses. I've spoken to my brother who's in medical school, my father, my partner in medical school, many friends in medical school. They do not teach this to you. So if you believe that your doctor is informed about the insert on a vaccine or the insert on a drug or the side effects, please know that they are not. I was an ignorant, naive 21-year-old idealistic, trusting girl who was under the impression that with the Hippocratic oath of medicine that doctors would know how to protect you, and they often do not. So please do your own research. Chances are that if you do your own research, you might end up knowing a little bit more about the current research of a drug than even your doctor does, even if it's in his specialty. So please, please don't make that same mistake.
Okay, and how was your acne after you took the drug?
Is that even a relevant question?
Well, yeah,
how was my acne?
It's on my,
I'm disabled. How was my acne?
Well, I like to give a rounded.
I have such nice, clear, smooth skin. Look at my skin; it's so nice. Yeah. I don't care. I don't give a shit about my acne. I'm in a lot of physical pain, which I'll get into.
Yeah.
I wouldn't care if it cleared my acne or if it didn't. This drug has really destroyed all the tissues in my body, and it's caused severe injury. So yeah, my skin is not capable of producing the same level of depth of the cyst that it used to be able to produce, because it has destroyed the levels of my epidermis. It has destroyed the network of collagen. It has destroyed my oil glands. It's destroyed my subcutaneous fat. So yeah, if you want to take this drug, it might destroy your skin so much that you are not able to produce deep acne anymore. So if that seems worth it to you, then go for it.
Okay, and that leads us on to what happened after you finished.
Yeah, so that's where the real party begins. What
Yeah.
happens after I finished the drug? So, actually, we got a little bit sidetracked, and I never completely finished my list of side effects while I was on the drug. So, just to summarize, while I was on the drug, I had the very normal expected side effects, perfect blood levels. I had dry skin, um, slightly increased sensitivity to the sun. I never had any serious sunburns or anything like that. I was really judicious about using my sunscreen, um, which is, it's like wearing goggles with an atomic bomb. Putting on sunscreen is just like, yeah. So, um, I had a couple of very minor nosebleeds that you know, I wish I had listened to my intuition, because I felt, oh my gosh, I am bleeding outside of my orifices. This is not good. But, unfortunately, the doctors will encourage you, oh, it's okay. It's normal. Nosebleeds are so normal. Don't worry. It's fine. So, yeah, I had a couple of very minor nosebleeds that I almost threw the drug away when that happened, because I was like, oh, I'm bleeding on my nose. It's not good. But they were really mild, didn't even soak up half of the tissue. So didn't seem concerning. I had very slight shedding of my hair. So I would kind of run my hands through my hair, and towards the end of treatment, I had, I still lose hair. I would have maybe 5 to 10 strands of hair come out every once in a while. I was really worried about this. I started looking it up online and getting very concerned. And I told my doctor, and he's like, "Oh, it's not to be concerned. It's normal to lose up to 100 hairs a day." Um, so that didn't seem concerning. I had pain in my ankle, which I was told, because it wasn't systemic, was not really related to the medication. My moods were worse. My depression was worse. My anxiety was worse. Um, what else did I have? Really, I'm trying to think if I had anything else while I was on the medication. Nothing. Yeah, I didn't have any. Um, my eyes were a tiny bit drier, but I didn't have to use drops or anything like that. I had a little bit of discharge coming out of my eyes, but it wasn't anything major. Um, no stomach issues, no serious brain problems, no vision changes, no night blindness. I didn't have any of the really serious concerning effects until after I stopped taking the drug. So that's my list of while I was on the drug. Towards the end, I ended up stopping it early because I was losing hair more than, I started losing like 20 strands of hair, and because um, my mood really got bad at the very end, right before I stopped it. So
Okay,
that's
and
when I
when
decided to
you
stop.
when you stopped taking the drug, did all of those side effects ease off? Did,
They got a million times worse after I stopped taking the drug. This is the message that I'm trying to get across. Not only did they not ease off, but everything in my life completely started to fall apart within a couple of weeks after stopping the drug. And it started off
okay.
with a mild thing, like more mild, and it just snowballed into something incredibly severe. Like I almost died 5 months after.
In my case, there was at least a couple of months where I felt relatively normal, and then
Yeah,
began to go downhill. But I never recovered fully after taking the drug. I
right.
knew I knew something wasn't right.
Yeah, there's a lot of different patterns of harm. I've talked to hundreds of patients on this. There's a lot of different patterns for how this can harm you. Sometimes you start having something really serious happen while you're on the drug. Sometimes it's not until a few days after, or maybe weeks or months after. So there's a lot of different ways that it can harm you. For me, it just snowballed into a very serious problem after I stopped the drug. And do you want me to outline what
Yeah,
happened?
yeah, yeah. Keep going. Yeah, so just list
Sure,
all of
yeah.
your long-term issues.
Yeah, sure. So, after I stopped taking the medication, what happened? To be honest, my coherency and memory of this is very limited because of how severe the reaction I had was after I stopped the medication. So, as far as I remember, about 2 weeks after I stopped the drug, I had become increasingly suicidal. I have had depression before in my life. I've had the random passing thought of suicidal ideation just based on the fact that before I took this drug, as a child, I was very severely bullied for the color of my skin. I went to a very white Caucasian school, and I was the only kid with brown skin. At the time, I had much darker skin than I have now. So, I had always dealt with some level of underlying depression or body image issues and occasional thoughts of, oh, maybe but it was nothing severe. I never have had a suicidal plan before in my life, but something just snapped in my brain after I stopped the drug. Um, the pain in my foot suddenly became incredibly severe. Um, After I stopped the drug, it went from being just an annoyance that kept me from fully exercising to the level that I had exercised before. By the way, while I was on the drug, I was incredibly physically active. I was rock climbing, biking, everything. After I stopped taking the drug, the pain in my foot became very severe. I started having pain in my knee, stiff, achy, throbbing, just really debilitating pain. And this pain started to really drive me over the edge, because if anyone has ever dealt with chronic pain before, it can really just drive you to a dark mental state, because it's unrelenting. It never gives up. You're with it all the time. After I had my foot surgery when I was a teenager at age 16, um, that was the worst pain in my life. I had a bone lengthening surgery in my foot to reconstruct my arch. So I woke up screaming from that surgery in just the most out of body, dissociative, horrific pain. If you can imagine Harry Potter bone growth, it's like growing your bones. So after I stopped the drug, the pain didn't quite get to that level of severity, but it got pretty severe to the point where I was limping, not able to walk. Really, it drove me to a very, very dark and angry place. And I think that in combination with all of the changes that were happening to my brain and my nervous system as a late effect of this drug, drove me to an incredibly suicidal state, because I could not escape the suicide, or I could not escape the horrific pain I was in. My friends started to notice I was acting really different. I started cutting myself for the first time in my life. Trigger warning for anyone, by the way. I had started behaviors that I had never done in my life before, due to the physical pain that I was in. And so the other thing that happened is that I started to lose my cognitive abilities, which was very scary. It started off with just a general fogginess, and it progressed to a level that I would say is borderline dementia at age 22. I was at the time. So I would find myself, this was maybe a month after I stopped taking the drug, I'd find myself at a grocery store, not knowing how I had gotten there, because I was so, I'm going to describe this in a different way. Brain fog is a euphemism for what I was experiencing. It wasn't brain fog. It was brain damage that I was feeling in my head. Something was very not right in my head. It was as if I had been on a combination of various different drugs at the same time. By the way, I never did recreational party drugs or anything like that when I was in college. I was a very serious student. So what I experienced felt like I had been roofied or drugged or something. It was really absurd. really scary. I was at a grocery store. I really didn't know how I'd gotten there. I couldn't remember if I had biked there or if I had driven there or if I walked there. I didn't know why I was there. I was wandering the aisles in circles, not knowing what I was even looking for. I mean, I'm telling you, it was like what I experienced in my brain. And this is coming from a very clear-headed individual who had achieved 4.0 grades. I was at the top of my lectures, the top of my class. I have a great uncle who is a famous mathematician of the century, on par with Albert Einstein and Paul Erdos. So I came from being a very sharp-witted person um, to being basically brain dead within about a month. So obviously it's terrifying, right? You're losing your mind, and everyone's telling you that I was seeing a psychiatrist, and she was just telling me that it was a stress related thing, and I knew it wasn't a stress related thing. I knew something very wrong was happening in my head. And I knew that it was not okay. I knew it wasn't right. It was really terrifying. So this continued to progress, but at the same time, despite the borderline dementia that I was having, and despite the physical agonizing pain, I was still able to maintain a level of physical strength and physical activity, and push through the pain that I was in. So I'd say, just to give a timeline, I stopped taking the medication in January of 2014. By February is when my brain was starting to fall apart. By March, I was very suicidal, cutting myself, very confused, really in a bad state. I was still working out. I was still going to the gym. By April, I noticed that when I was lifting weights at the gym, something was wrong with my elbow. I was having shooting pain in my elbow that I'd never had before in my life. By April, I had pain go into my hip. Late April, while I was in a intensive yoga class, I started to become very, very physically weak in the middle of the class, which had never happened. That didn't happen to me while I was on the drug. So midway through the class, I just started to tremor and shake. And I remember I couldn't stand up. I had to lie down. It was kind of like my nervous system was falling apart, and I didn't know what was going on. So I just laid down, and I went home after that, and I tried to get some rest. So I was still, despite all this going on, I was still performing. I was trying to maintain my abilities in school, which was very difficult. I had to withdraw from several classes because my brain was so dead. I was basically demented at this point. So, keeping up with upper level biology classes while your brain is basically demented is not very easy to do. But I was still rock climbing, and I was still able to achieve one of the highest level climbs that I had done despite everything. And so I was still really pushing myself hard. I remember having this intuitive feeling that something really wrong was happening in my body. And as I was doing a certain rock climb, I felt I had to get that climb I had to get it that day, because I felt like if I didn't get it that day, that I might not ever get it in my life. And it was just some intuitive feeling that I had. So I pushed myself, I had all my friends around me cheering me on, and pushed really hard. I got the climb, and I was really happy about that. And that was about maybe April. Yeah, late April, I believe. And so by the time May rolls around, um, this is when I really fell apart in a really, really dangerous way physically. This is when I pretty much almost died. So it's still, I had been going to doctors, by the way, and none of them could give me any answer. My blood tests were still perfect and normal and fine. And, I had gotten MRI scans on my foot and my knee, and nothing really abnormal showed up. there was no signs of any kind of ligament hyperostosis or joint swelling or arthritis. There's not really any sign of that. So I was, just said, oh, take some pain medication. It's all in your head. It's, whatever. So by early May, I noticed that my scalp was really just on fire. Like my scalp was tingling, my hair started to fall out. And at this point, I knew that something was really, really wrong. So with everything that was going on, with the amount of physical pain that I was in, with the amount of brain damage I was experiencing that I had no way of being able to comprehend, with the stress levels that I had, with trying to maintain school in this very compromised, neurologically damaged state, I was very, very, very suicidal at this point in time. And I actually did try to hang myself, and then I stopped and I snapped out of it. And so it got to a point actually where I was not really aware of my surroundings. And the whole world was just kind of spinning, and I was just crying all the time. It kind of felt as if there's an error signal on your computer, and it's like error, malfunction, that like this is how my brain and my CNS and my nervous system was feeling. So I will say that I have very limited recollection of what actually happened during this time, but what I do know is that because of my suicidal tendency at this point, I was given the choice of going to an in-treatment hospitalization or an out-treatment center. At the time, I was starting to get really physically weak, so it didn't really feel like a choice. So I ended up not really being able to have the strength to fight this. I ended up going to an outpatient center for people who are depressed, which is just completely um, completely an insult to the type of injury that I had, because it wasn't depression, it was brain damage and severe body damage that I was going through. So while I was at this place, I knew that something was really, really, really bad. And that's actually when my body completely fell apart. It wasn't due to a mental breakdown. It wasn't due to stress. It wasn't due to depression. It wasn't due to childhood trauma. It wasn't due to any of the reasons that I was given for, oh, it's all in your head. This is just happening because you're a crazy person. At that point in time, I had started to research, because I was told not to do this in the beginning. I had started to actually research deep into the internet blogs of Accutane. Back in 2013, really, the only information you could find on this was hidden deep on health blogs that the doctors tell you not to look at. So I knew what was happening to me. I knew that it was really serious. I was aware of what was happening while it was happening, which is one of the scariest things that you can go through. While I was there, I went through what I believe to be some type of stroke or meningitis, non-viral, non-bacterial. I basically lost consciousness for a period of 48 hours. The symptoms I experienced were incredibly physical during this time. So I had full body spasms and tremors, full body shakes. I was putting ice packs on from head to toe on me, covering myself because my whole body was burning like it was acidic on fire. I was in and out of the ability to be conscious of my situation. I didn't know really where I was. But I remember that time really feeling, without being dramatic, that my body was shutting down in a really serious way. It was a near-death experience because I was so in and out of consciousness at this point in time. And it wasn't due to any medications that I was on at that point. I do know that perhaps one of the, while I was there, my father had prescribed me a short course of prednisone to help with the inflammation that I was having in my body. So, but this was happening regardless of that.
What did
So
the doctors at the hospital or the facility
at the facility, they were incredibly dismissive, incredibly unhelpful. I was told, I was severely mistreated at this place. Because as a biology student, I knew that, I had never lost my mind in my life, and I knew something was very wrong with me. I knew that I was not schizophrenic. I was not psychotic. I was not hearing things that were not there. I was not psychotic. It wasn't depression. I knew that this was a really physical reaction, but they dismissed it. I actually had a non-contrast scan taken of my brain. They couldn't find anything of significance. They took a few blood tests. They couldn't find anything of significance. And beyond that, they didn't really search further than that. So they basically just told me that, I was making up, I was making it up for attention, which I have no idea why. If I'm going to make up something up for attention, why don't I just go climb the face of Half Dome, which is what I was planning on doing, right? I have a lot of things I could make up for attention. Why? I don't know why I would end up in a stupid facility. And
it actually sounds very similar to that movie Brain on Fire. Have you seen that?
Yeah, it sounds like it. I've not seen it, but
it's basically there's a girl.
Yeah.
She ends up in a mental facility, but and she's treated like she's crazy for a long time.
Treated like you're crazy, but you're not. You're not crazy.
Yeah, well, she's treated as if she is for a long time, and then they finally figure out that she's got an autoimmune disease that's eating away at half of her brain.
Right.
Yeah.
Yeah, it's one of the most hellish experiences you can possibly imagine, and it gets worse. So what happened to me, I do not wish upon. Maybe I wish it upon Adolf Hitler, but I don't know, man. I mean, I don't know. Like, some people say he was. I'm just kidding. I have Jewish ancestors, so I mean, I have ancestors who survived the Holocaust. I'm just kidding. No, I mean, he's maybe the only one, or maybe the makers of Roche. But I mean, this was an awful experience. I would not wish upon anybody. When I was there, I was dismissed. I was mistreated. I was told that it was a reaction to depression, that it was in my head, that whatever I had going on was just me trying to get attention as a young 22-year-old who just needed attention and maybe had daddy issues, or just the complete ridiculous BS that they will tell you it's just absurd. So I was very much dismissed for my physical injury when I was there. While I was there, I started to develop Parkinson's-like tremors uncontrollably. I started to develop shakes. I was losing coordination. I was bumping into things. I was falling over. I lost the ability to walk straight. I got to the point where I was crawling. I couldn't stand up because of neurological muscular weakness. I eventually ended up unable to leave bed for 48 hours. I don't even know if I urinated or not. I could not leave bed physically. I was in such a haze. I didn't eat food. I barely drank water. When I finally, and the whole time they were trying to force pills on me, and I had to pretend to take the pills that they were giving me because I knew I was not crazy, okay? And I knew that the pills that they were going to give me would make my condition significantly worse. So I had to, while I was there with my brain under some kind of attack, I had to strategize some plan to not become further abused and damaged by the medications that they were giving me, while also suffering from this horrendous injury that was almost like some kind of stroke. I don't
This
know what
seems
it
to
was.
be a big problem with people in the aftermath. If you haven't got that presence of mind and you just hand yourself over to the doctors, they will just keep giving you more and more drugs.
Yeah, you can't.
And you'll just get worse and worse.
You just become like a puppet, pumped with medication until you're brain dead. I mean, I see this happening, and this is something that, by the way, Peter Goche, who's one of the directors of the Cochrane collaboration, he writes this book called Deadly Psychiatry and Organized Denial, like the industry of deaths. And so he talks about just the dark side of psychiatry and how so many people in the system are not mentally ill, never were, that a lot of them have iatrogenic illnesses or other serious physical conditions mislabeled as being psychotic and are given drugs that further harm them until they have some kind of permanent or irreversible brain damage, and then they eventually end up, dying in some, this is a very serious example that he's talking about. But yeah, so back to me lying there, going through this severe injury. When I woke up finally, it was so, I cannot explain to you. This is the most traumatizing event of my life. I can't tell you how traumatizing it was. I woke up and my hands are paralyzed. Okay, so yeah, here I am at a psych facility. I'm not psychotic. I'm being told by every single person there that I'm psychotic. Nobody believes me. They all think that it's in my head. My own parents, who are in the medical community, my mom being a nurse, my dad being a doctor, and my brother having been in medical school, they all just thought that I was losing my marbles, okay? And I wake up, my hands are not functioning. I look at my hands like this. I'm trying to open them and close them, and they're not working, okay? Like I was a rock climber, a very serious rock climber, an artist, an aspiring veterinarian, perhaps working in some labs. My hands are everything, right? As a rock climber and an artist, your hands are everything. And so you wake up and you're looking at your hands in a psych facility where everyone tells you you're crazy, and then your hands are paralyzed. Okay? Can you imagine? Just try to put yourself in these shoes. Your hands are paralyzed and your brain is demented. And you don't know what's going on. And everyone there is just telling you that you're making it up and that it's not real. So I recorded some video of myself trying to move my hands, looking at them, saying I am trying to move my hands right now, and they're not moving, right? Okay, they work now. I can move them right now. But during that time, I could not open doors. I could not hold on to cups. I could not use my cell phone with my fingers. I could not write. If I needed to do anything, this was the extent of what I could do. That.
Yeah.
I couldn't, my fingers didn't open or close. They didn't do this properly. So, yeah, it was pretty terrifying. The other thing I noticed when I woke up and came to consciousness out of this episode was that I couldn't move my neck. I tried moving my head and it didn't move at all. It was like paralyzed almost. So I'm not sure what the hell is going on in my body, but I'm not able to move my neck. The next thing that I noticed as soon as I sat up in bed is that every single joint in my body is making these noises. This is really common post Accutane injury. Your joints get decimated. They get fucked up. So every single joint in my entire body is cracking, clicking, making these horrific noises as if you're like 117 years old, in severe pain, catching, locking, like I can't, you see that? That's not normal. At age 22, my whole body just started to seize up and was falling apart. And so this all happened really quickly. Similar to I watched Ido's story, and he has a very similar story of what happened to him. Within a day, his joints just completely got decimated. At this point in time, I knew what was happening to me, and I knew why it was happening to me. And so here I am, completely destroyed by this drug that I had taken 5 months earlier. And I'm trying to tell everyone at the facility, like, no, I'm not crazy. I am severely damaged by this drug. And everyone is, there's no way that a drug could cause damage to you. There's no way that you could get hurt by a drug that you've already stopped. Like, that's not even possible, right? My dad's telling me this. My brother is telling me this. My mom is telling me this. I contacted the dermatologist who gave me this drug, and I told him what was happening, and I said that I'm falling apart from this drug, and I've never heard of this in all of my medical literature. I've never encountered anything like this. It's not possible. It's not possible that you could fall apart after you stop taking a drug.
Well, if you don't go looking for that information, you're not gonna know, are you?
Yeah, it's part of the organized denial, I think. So I knew what was happening, and it was just the most terrifying thing. It's like you wake up from your own personal hell, and you realize, you start reading about these like really buried, hidden, at this time in 2004, it was 2014 at that point in time. This was before any of the Facebook groups existed. This was before people were out there publicly speaking about what this drug does on YouTube, except for Stefan. He's the only one who talked about it. But he didn't have as severe of a reaction as I did.
It's probably a good
And
time to mention, actually, if you want to join a Facebook group, if you've been affected by this medication and you'd like to speak to other people in the same position as you, head to the Accutane long-term side effects group on Facebook. It's a closed group, but if you request to join that, I think Zach should approve your request.
Yeah.
And then you can join the pity party.
It's a group of really happy individuals in this.
Yeah.
No, I mean, people are supportive there, and that's, I believe, that's how I met you, I think.
Yeah.
Probably.
Yeah, I think so. Yeah.
Yeah. And no, there's some really wonderful people there. But so anyways, this was before all of the wonderful support groups that exist of people who are actually out there actively speaking and talking about it. I believe this was even before Propecia Help was talking about post Isotretinoin or post Accutane syndrome. It was before any of that. And so a lot more awareness and people coming out of the closet and speaking out about this has been happening, I'd say, in the most recent past few years. Maybe you can agree with me on that because you've been dealing with this for a while. I don't know. Maybe I was just completely unaware, but I know that there was this long running acne.org, like repairing the long-term damage of Accutane, that like I think Stefan had made back in 2009. But of course, it's like, this is the depths of the internet that you might not find unless you're specifically looking for it. So at that point in time, there wasn't like as much talking out about it as there is now.
Even prior to that, though, prior to me taking the drug, I did hear a couple of stories of people who'd taken it and they'd been affected by it. And that wasn't in the news or anywhere else in the world. That was in my own community. In your own community, yeah. There was people on the island that I was living on who'd taken it and been affected. Mm-hmm. But you tend to think that it's rare and it's not going to happen to you, or or they're exaggerating.
Well, the risk that they claim is inaccurate, and that's something I can get into later. I don't know how much time. I don't want to go over how much time are we.
We can take as long as you want.
Sure. Okay.
Let's just keep telling your
angles. Yeah, there's a lot of angles of this story that I can discuss, and some of the angles are just to give you an idea of how misrepresented this medicine, I don't want to call it medicine, that this drug is in the medical community. So I'll talk about that maybe after I finish talking about my severe reaction.
Sharing,
5 months after my severe unheard of crazy reaction. Right. Okay. So yeah, it's not an understatement. It's completely accurate to say that I was completely disabled at that point in time. I remember it's like a funny story because everyone there just thought I was depressed and, unable to cope with the stresses of life and, not really able to manage my, maybe not adjusted to being a young adult in the world. And so I was with all these other people who had situational depression or bipolar or, maybe overcoming addiction, or I was with people who had true mental health illnesses, which is a very serious thing, and which I actually gained an incredible amount of sympathy and empathy for these people. And so it was an eye-opening experience because I never imagined that I would end up anywhere like that. I was such a high functioning person. I never ever would have imagined me in one of those facilities. So it was just one of those absurd, like out of a movie, just bizarre, ridiculous, hellish experience that you never think will happen to you, right? And so I was there. It's a funny story. I was so mad. I was so mad at this point in time. Like, this is another thing, is that this drug, similar to the the polar explorers in the Arctic that accidentally eat too much polar bear liver, they become very angry because it damages part of your brain that controls violent outbursts and anger and regulation of mood. And I think it's like the hippocampus and prefrontal cortex. It damages these areas of the brain. So you're naturally angry. But then I'm angry on top of the natural anger that is caused by the brain damage because of my situation that I'm in, where I am quite literally paralyzed in a psych facility with everyone telling me that I'm crazy. And so I remember they tried to force me to go to a knitting circle so that I could talk about my feelings with other depressed people. And I'm at this knitting circle and they're like, come on, you can do it. You can knit. Come on, we believe in you. And I'm just like, I want to kill you guys. I'm so angry. Oh, I was so angry at this point in time. I was glaring at everybody there. And I was like, I can't knit. And they're like, yes, you can. You can do it. You can do it. I believe in you. And I'm like, no, I can't, because my hands are paralyzed and because no one is believing me that my hands are paralyzed.
So
And they're like, no,
you
no.
went
They're
from
like,
rock climbing to knitting.
yeah. I mean, why would I make this up, right? Like, if I wanted to make something up, I would go climb Half Dome, which is what I was planning on doing. So, I mean, it's just absurd. It's absurd that I would make something like that up. And so they're trying to say, like, come on, you can do it. Like, we believe in you. You can knit the scarf. And I'm just glaring at them. I'm like, I can't. My hands don't work. They're paralyzed. They're non-functional. They're basically just like lumps of clay. They're not working. Um, and so then I was told, I overheard, it gets worse. I overheard hear the members of this facility. They're speaking to my parents, and they tell my parents that it's best that my parents don't communicate with me at this point because they don't want them to feed into my delusions. So yeah, I mean, it's like, what is the mystery here? Like, retinoids are neurotoxins. They're CNS toxins. This is something that dermatologists cannot get through their thick head. Like, there are so many established bodies of information on PubMed that say this shit is neurotoxic. And also, there's a lot of proposed mechanisms for why it might have delayed effects, just like chemotherapy has delayed effects, just like fluoroquinolones have delayed effects that have been recognized in the FDA black box warning, that central nervous system damage and fluoroquinolone associated disability can occur weeks, months after discontinuation of the drug. So this is recognized in several medications, right? It's not recognized in acetretinoin for whatever denial reason that there is in the medical community. And so, yeah, I'm very aware of what's going on while simultaneously being very brain damaged and while having people at the psych facility trying to cheer me on, telling me that I can knit a scarf, and me saying basically, no, I can't. I mean, I wasn't even able to do this, okay? Like, I wanted to very badly. I mean, it was just, maybe I'll write a book on it one day. It was really just the most absurd, terrifying experiences of my life. I really I didn't know if I would ever be able to use my hands again. And that was just, I mean,
I would say I've been affected in a similar way, but nowhere near as severely as that. Like
mhm.
my job, I maintain alarm systems, as you know, but people viewing this don't know. And yeah, whenever I do something, whenever I repair something on an alarm system, I have to make a logbook entry. And if I obviously all those logbook entries are dated, and I go back to those sites every 3 or 6 months, and I can see how my handwriting deteriorated
Yeah.
over, or
Yeah.
how it's deteriorated over that period. It's better now, but still sometimes when I'm not feeling too great, my handwriting isn't anywhere near as good as it used to be.
Hmm. Really safe drug, right? Great drug.
Yeah, yeah,
Very safe.
yeah.
Um,
Life
yeah,
changing.
so young people losing their neuromotor capacities to various severe levels. So yeah, that happened, and then the other things that happened while I was there, besides the decimation of my joints, feeling like an atomic bomb had gone off in my body, basically feeling completely, I lost, at this point in time, I had lost almost all of my memories in my life. I was basically, it felt like I had a traumatic brain injury. Um, I was aware enough to know that I was not crazy and that I knew who I was, and I knew that what was happening was very, very wrong. And I had lost a lot of memories of the prior months. I lost a lot of memories of what had happened in the past few months before that. And so another thing that happened while I was there, and I have some documentation of this because I was taking photos, is that the insides of my mouth started to peel. Like I had chunks of skin coming out of the insides of my mouth. And so I'm literally like sitting there, like trying to hold my phone without my hands working. Like I could hold my phone like this, and I was able to like sort of do that but not moving my hands. So I was like trying to make phone calls, like trying to tell my mom, like, hey, chunks of my mouth are falling off. I'm dying, you know? I have like clumps of skin coming from the inside of my mouth. Um, I had massive loads of hair loss while I was there. So um, giant balls of hair coming out. I lost rapidly, I'd say probably 60 to 75% of my hair. So just, I'm talking like chemotherapy hair loss. Within a period of a week, I was losing massive, massive clumps of hair that would fit into my palm every single day. Just, it was just coming out like hundreds of pieces. Um, this was right before I completely collapsed. So I knew that my body was really falling apart at this point. I'm trying to think of what else was happening. I became very sensitive to the sun with my eyes. So I had to wear sunglasses everywhere. This is not something I had while I was on the drug. I had to wear sunglasses in my room. I became completely intolerant to the light. It was excruciatingly painful to my eyes. Um, my skin started to change. So I was noticing that I had little small spots on my chest of different texture and coloration of skin. And it happened in patches. And I noticed that in the patches of skin that I was having these weird spots, they were very, very thin. And so they were almost like crepe paper thin. And so slowly my skin was being replaced by very thin, thin skin that was damaged. Um, so yeah, hair, joints, nervous system, brain, um, inside of my mouth falling apart, paralysis. Um, yeah, trying to think of what other systems I've had affected. I mean,
Well, let's fast forward a little bit, or move on a little bit from when you were in the mental facility. How long were you in there for?
I was in that. I was in there for I don't remember. I think it was 5 or 6 weeks. I after 3 or 4 weeks, I regained most of the movement in my hands. So I was able to mostly use my hands, and so they were not paralyzed anymore, which I was happy about, I guess.
Okay. And what's happened since then? Or what happened after you got
After,
out
yeah.
there?
So I got the hell out of that place, and my life is completely it's like, it's like you have this ideal life, right, that is going in a direction that you believe in, and then suddenly there's just this atomic bomb that just like leaves you half dead. And then you're just like, well, what now, right? So that's what happened. An atomic bomb went off in my body, and
I guess it's a similar
very,
experience to a lot of people that end up unwell, but the frustrating thing is that you know that it's because of something you've taken or,
yeah.
a
You
choice.
say to a lot of people who end up on what?
Well, it's a similar experience to people that are taken down by some kind of illness,
Right,
but
right. Yeah.
you know that it's the result of something, a choice that you've made, a drug that you've
Yeah,
chosen to take, and
right,
that's more of a it's more of a blow because
right.
you you there's so much regret.
Exactly. Yeah. Suicidal levels of regret.
Yeah.
I mean, just enough to make you go to really dark places, and anger, a lot of anger over what happens. So, so do you want me to talk about what happens after I left the facility, or do you want me to talk about like a chronological explanation of what has happening?
Yeah, just keep telling your story. When you came out of the
Sure.
facility, did did things, well, as things started to improve, what improved, and
Yeah,
just keep
sure.
taking us up to
So,
the point we're at now.
yeah. Um, so, everything's decimated at this point, and I was very incapacitated, both cognitively and physically completely incapacitated. Was pretty much bedridden for many months. As soon as I got out, I spent a few weeks at my parents' house, and the amount of just explosive conversations and arguments that we had based on them still not believing what had happened to me, and my father's contribution to this whole event, which I should have spoken about earlier, actually, um, was just not conductive to a healthy time at all. And so I was told that, they still believed it was a psychotic episode, and they still believed that it was psychological. And so I was basically given an ultimatum that if I did not take the medications that they wanted me to take, that they thought I needed, that I would have to leave. And yeah, because they just thought I was still feeding, and they thought I was still delusional. They thought that they wanted to not feed into my delusions of being unwell, and of being weak and in pain and in horrific, chronic, crippling pain all the time. Um, so I decided that I needed to leave, and I ended up um, I ended up leaving and just having some of the darkest period of my life, where I had to do all sorts of crazy things to make ends meet and to try to support myself financially, to try to be independent, because ultimately I knew that I had awoken to this whole world of the dark side of medicine. And I knew that if I had allowed them to give me care in a medical sense, that I would continue to get worse and worse and worse and worse. I knew that this was true because of the fact that I went to so many doctors, and they all told me the same thing. Just, it's psychological, you need to be taking psych meds, you need to be taking antidepressants, gabapentins, and Volta, et cetera, et cetera, et cetera. I knew that in order to escape the paradigm that I was in, which I had been caught in this Western medical paradigm for my whole life, that I had to run away from it. And so in order to save my life from further brain damage from these medications that I knew were not right for me, I ended up going through periods of time living out of my car, homeless, going through periods of time living with my boyfriend at the time, who I am incredibly grateful for because he did save my life when I was feeling really unwell. There were times that I was so physically weak that he actually had to carry me because I would collapse on the floor and not be able to get up. So he'd have to carry me sometimes. And, but I, it destroyed my career, destroyed my family, destroyed my health, my body, my brain, my life, and my relationship too, because I knew that I couldn't be in a relationship at that point in time, and I knew that it would not be fair to have someone stay with me when I was so unwell. So I broke up with him, and I was living in the woods for a while, just trying to survive. I eventually got, some jobs that I was able to do. My brain did recover to some extent. It actually has been continuously recovering over the years, but I am still nowhere near where I used to be with my brain function. So,
this is probably touching on something that is the most important element of returning to health when you've got an illness, and it's something that I heard Natasha Campbell McBride talk about in a recent interview with Primal Edge Health on his YouTube channel.
right.
She says that no patient of hers can ever recover unless they have the support of their family, their friends and family.
And this is why I'm doing this. This is why I am putting my face out here on a very vulnerable platform where I'm opening myself up to ridicule, to mean comments, to people making fun of me, saying I'm crazy. I'm doing this because the survivors of this medication deserve to have the same level of respect as anybody else who's suffering. And the very sad thing is that it's just such an isolating condition, because whenever you have any kind of iatrogenic illness, whether it is a severe reaction from a vaccination, whether it is fluoroquinolone damage, whether it's damage from Lupron, whether it's damage from isotretinoin, even SSRI damage, there's so many medications that cause really serious harm. And because the medical community is unable to recognize and to acknowledge these conditions, it leads to the destruction of the family unit, because if the doctors aren't recognizing it, then the families are not going to either. And so I was dealing with severe levels of disability and illness, and I had zero support from most of my family. Just really on an emotional and psychological level, they were incapable of comprehending what had happened to me. I had a few friends who were amazing people who gave me support, but I'll say most of my friends left. It's okay. I've forgiven them. I don't mind. It's, I understand they probably just thought I went crazy. But whenever you're going through something severe, if it's cancer and chemotherapy, if it's any kind of severe crippling condition, we need that social support. And if you're going through a drug injury, chances are you might not have that unless you're really lucky and you've been gifted with very understanding family, which I love my family. I love my parents, but they were incapable of comprehending and acknowledging what had happened to me. I think it was too painful for them to understand. And I think that it was outside of their paradigm of comprehension as well, being within the medical community.
Yeah, and if your parents who were in the medical community couldn't understand it, then imagine what it's like for normal people. I mean, this is something I've never really I haven't really talked about yet on this channel.
Possibly better for normal people. I mean, maybe not actually.
Yeah,
I've heard horrific stories where it's not.
I know in my case, I was in a relationship when I really began to fall apart, and you know, you're sleeping in the same bed as somebody every night, and you're obviously telling them you don't feel well
Right.
every day, and it doesn't just affect them. It doesn't just affect you. It affects them as well, because it affects everything that you're able to do together.
Yeah.
So you're telling this person, oh, I don't feel well. I don't feel well. So they're kind of telling you, go to the doctor, see what they say. So you're going to the
Yeah.
doctors, you're having blood tests, you're doing everything that's within their realms of knowledge, and then you're going back to your partner and saying, they're telling me there's nothing wrong with me.
Yeah.
And then you're this person who is supposed to love and support you begins to tell you that you're crazy,
Yeah.
and then it just falls apart. And yeah, and then that just adds to well, it adds to the suffering, really, doesn't it? You've got to
Yeah.
pick
It's,
yourself up from that, as well as feeling unwell. And you were talking about when you were talking about the rage thing earlier, or, you know, when you're doing the knitting class, another thing I've never
yes.
spoken about on this channel, I haven't really spoken about it to many people at all, is that um, I I once flew into a rage and smashed up a TV in the aftermath, because
Hmm. It happens.
yeah, it just you lose control of your anger. I don't know
Hmm.
the mechanisms of it, but I mean, I heard another story from. See, I talk to people about this drug. I talk to my alarms customers about this drug, and I had a conversation with an Australian guy. Um, he sat me down and asked me what was going on in my life. Very, very friendly guy, and we would regularly sit down and have a cup of coffee when I went around there. And he told me that his son was also affected by this drug, and he said that he
Yep.
had an episode where he was on holiday somewhere with his wife and their child, and he had to tell them get out of the room, and he locked the hotel room and just smashed everything up.
It's unreal. It's
Crazy.
unreal what this drug does to your brain. It's not, it's a physical change in your brain. It's not psychosomatic, it's not emotional, it really changes the structures of your brain. I mean, this has been shown in, I think it was 2005 or 2006. Doug Bremner nearly lost his career going to bat for his research paper that he came out with on how this physically changes the brain. And it was really, I read the book that he wrote on it, The Goose That Laid the Golden Egg, and he went through hell with private investigators from Roche coming, you know, going into his house and trying to pull up any amount of dirt that they could, because, you know, these pharmaceutical industries are so powerful that they will do anything to try to destroy anyone who opposes them. And so, yeah, the information, they try to keep it hidden,
Do you have any
but
links?
it's there.
Do you have any links to anything he's written?
Yeah,
Yeah.
maybe
Okay.
you could link it to
Yeah,
your
we'll put them
down below. Sure.
down below. Yeah, in the
Yeah.
description. Yeah. Okay. Cool.
Yeah, I'm a fan of him. So, yeah, so the aftermath of this is just complete annihilation of your life on many different aspects.
So,
I will say that my lifeline, I believe, I met one of my best friends that I had ever met um, in my life right after this drug. And I didn't talk about it after it happened. It was so traumatic to me that I didn't. There's so much stigma and shame and trauma around the event that I just didn't really talk about it to anyone, really. And so, it's kind of like I had to start my life over again. I will say that that friend who I met right after the event, still an amazing friend to this day. I owe a lot of my life to her, and to my boyfriend at the time, who was amazing and who believed me when my family did not believe me. He never questioned me. I mean, he was so kind to me during that time. And he even offered to visit me at the facility when I was falling apart. And I did not want him to see me like that. So I told him no. And um, he was just so supportive. I'm really lucky for him. He knew I wasn't crazy because he knew me. We had been best friends before we dated we were like best friends for 4 years. So he knew me, right? Like he knew who I was, maybe better than my parents did. And so he's still a friend to this day. And yeah, I appreciate that he believed me. And, ultimately I begged him to break up with me and he wouldn't do it. So I broke up with him kind of, and maybe it was mutual. I'm not sure. We just broke up because I couldn't be in a relationship in that state. I was not a fun person to be with. I was just bedridden. And so I tried to piece back the parts of my life, but, clearly not as functional as I had been before. On my own, I somehow worked up the strength to have a couple of jobs, even though it was just excruciatingly difficult. I mean, just in severe pain with really bad brain fog, cognitive damage that I was trying to repair. Immediately I went to trying to heal my body, and immediately I went straight to the paleo diet initially to begin with. And so, in the aftermath of this, I had completely decided that pharmaceuticals were not the answer. I learned that lesson the very hard way in my life. And so I went through the long effort of trying to repair what damage had occurred to my body, and with limited amounts of success. But, maybe that's another video of like what I've done to try to get better and what has changed. And I still have a lot of damage. I still have very high levels of pain. I could probably write some kind of manual on natural medicine because I've tried so many different things in the alternative holistic realm. I mean, it's comical how many things I have tried. Like everyone who's suffered from Accutane damage has tried so many things. And so that's another topic. I tried the paleo diet. I tried it for about, I first did the generalized paleo diet, and then I went into the paleo autoimmune diet, and then I further restricted and I cut out all eggs. I cut out nuts at that point in time. I tried different variations of having red meat or not having red meat. I tried different variations. I cut out, no caffeine, no sugar, no grains, no alcohol, no caffeine. I think I already said that. No sugar, no. I was eating very, very limited diet, and I did that really strictly. Never cheated. I was super, super gung ho about healing my body at this point in time. And I'll tell you that my issues are not digestive. Okay. So I got pretty lucky, I guess, with the Accutane roulette. I did not and have not to this day experienced, which is kind of ironic because it's like they say, oh, IBS is connected to Accutane. I didn't experience that. I've never have. So on the various different levels of tissue damage that this drug can induce. I received damage to my musculoskeletal system, nervous system, brains, CNS, definitely that took a big hit. My skin, my hair, and to some degree my eyes, but I did not really experience digestive system issues. So
optional question here. Has it affected your sex life at all, or did it affect your sex? Did it affect anything to do with that?
Let's see I'm not sure, because I've taken SSRIs in the past, which I think had more of an effect for me than with Accutane. It's different for everybody. It's affected my whole body, so of course that's going to indirectly affect the sexual side of my life as well. I don't think it really had a super direct effect on me. I don't have a penis, so I don't have erectile dysfunction. So yeah, I mean, it's made everything that I'm suffering with definitely affects my sex life, but I don't think it has a direct effect so much. Maybe a little bit.
Yeah, I'd say with me it was just general feeling really unwell.
Exactly.
You
I mean,
don't
it's like, who
exactly feel
wants,
sexy when you're falling apart.
yeah, it's like having sex with your sick aunt who's like just gone through cancer, you know. It's like who's just gone through so many rounds of chemotherapy, and she's just like, oh, my bones hurt, you know. It's like, it's just not the sexiest injury to have, I guess. It's not super hot.
Yeah, I think I just began
But
prioritizing sleep over
yeah,
anything
or
else.
pain management, or just like
Yeah.
it's trying to escape your pain because it's like the pain gets so bad. So yeah, I mean, it's not really a sexy thing to go through. That being
Mhm.
said, I went through a lot after this happened, and like, um, yeah. So we were talking about diet and
Yeah, if just so we stay on
stay
track,
on
or
topic.
just
Thank you. I
yeah,
get off topic a lot.
it helps to have a few prompts.
Sure, sure.
Okay, so what would you say is the worst of your long-term side effects?
Musculoskeletal problems for sure.
Yeah. Okay.
My skeleton is fucked up. I mean, I'm sorry. Maybe you can bleep that out if you need to. I'm a little.
Yeah, apparently the YouTube algorithms don't like swearing these days. I need to be a bit more mindful of that.
Oh, sure, sure. Okay,
Yeah.
you can edit that out then.
Yeah, I'm not
I
sure
get
how I'm going to do
passionate
that.
sometimes.
But yeah, well, I think it's important for us to be real, though. Like,
Yeah,
I
I'll
think,
be careful with my.
I
So
think,
yeah, my
I think when people are looking for answers after being affected by this drug, that they're, I don't think algorithms are going to prevent them from finding
sure.
what they need to find.
Yeah, yeah, you can. Be,
Yeah.
yeah, so my musculoskeletal system. If you want, maybe right there or something. Maybe I can attach an image of my beautiful MRI if you want.
Yeah. Okay. We might try to add some
We'll
images
we'll
afterwards.
see. We'll
Yeah.
see.
Yeah.
Maybe.
Yeah.
Um. So yeah, by my mid-20s, I had the discs in my spine image because it's gotten to the point of being so bad that um I was not able to move my neck at all. Like it has been so bad that I have periods of time where I can't drive because of crippling neck pain. Like I'm talking like 9.5 out of 10, like almost as bad as my surgery. Like the pain gets debilitating, and I refuse to take any kind of pain medications because I just will not go there. But it gets really bad. And yeah, I do a lot of natural things to try to bring down the inflammation, to try to, take lots of supplements. And I can talk about that at some point later. But yeah, nothing really touches the musculoskeletal pain that I have. Unfortunately, it's a tissue that's difficult to affect by diet. It's not impossible, but depending on the type of injury that you have, if it's an autoimmune injury in nature, then there's a or inflammatory injury, then there's a higher response rate to different types of diet or anti-inflammatory things that you take. But if it is, on the level of which I believe has happened, the discs in my neck have been desiccated um, because this compound interacts with the proliferation of every tissue and every cell pretty much in the body. And so, yeah, you have the synovial membranes and the synovial sheaths in your tendons and your ligaments, in your joints. You have fascia everywhere. And so all of these tissues get affected, right? So you think it's this fallacy to think that the skin being the largest organ in your body being affected, and you think that your other tissues won't get affected as well. It's just
Exactly. Yeah.
completely
Your skin
absurd.
covers everything.
It's
So
absurd.
basically,
Yeah.
if the drug it is affecting all of your skin. It's going to have body-wide effects, isn't it?
And this is the lie that they often tell you, is that a lot of dermatologists I've talked to afterwards have said erroneously that the drug specifically targets the sebaceous gland of the epidermis. This is not true. It does not specifically target anything. There are retinoid receptors in just about every tissue. I mean, it's just complete dissonance that they say one thing and it's just it's really insane, the types of irrational logic systems that the doctors use to rationalize this horrible behavior of prescribing such a toxic medication. And but they do, and then they'll say it selectively targets your skin, and it doesn't, because I have damage in all of my tissues. I have multi-level disc bulges and disc desiccation. I had my neck imaged, my cervical spine, and almost every disc in my neck is bulging, and almost every disc is dried out, and I have several annular tears in my discs. And my neurologist, she looked at it and she was like, did you have a massive head injury or something? And I've done extreme sports in the past, but I've never had an injury that resulted in any type of neck pain. I didn't have neck pain until after the drug. So yeah, that's definitely the worst of my effects. My nervous system is a close second. I have electrical shooting horrific nerve pain everywhere in my body all the time. I feel like I'm being plugged into an electrical socket. And the brain fog. Those are the worst things I experience.
Have you reported any of these things in an official way at all?
Yes, but I've had to do it by myself because none of the doctors, they all refused to report it. They wouldn't do it.
Where can you go to report this kind of thing in the US?
It depends on what country you're living in. I reported it through the FAERS system, Federal Adverse Events Reporting System. I had to I spent some time looking on the FAERS database, and it's very concerning. Only an estimated of 1 to 10% of drug reactions are ever even reported to FAERS, but still there's a staggering amount of reactions with this medication. So
Okay.
I reported it myself because my doctors would not do it.
For anybody who's watching in the UK, there's actually an app that you can download. I think it's probably on iOS and Android. It's called Yellow Card.
Oh, I've heard of that. Yeah.
I can put a link to that
down
in the description as well. If you have been affected, you must report it. It's really important. Okay. I've lost my questions now. Bear with me.
Sure, no problem.
Okay. They're back. I guess we kind of covered this, but have doctors been helpful during the aftermath?
I love that question. It's a great question. Have doctors been helpful? Let's see. What's the most helpful thing that I have received from a doctor in the aftermath? No, they've not been helpful. They have been the opposite of helpful. They have been dismissive, rude, often, at worst telling me it's psychosomatic and then I need to go seek therapy. At best, there will be some doctors who genuinely care and they want to help and they want to be, they are sad to see that I'm suffering, but they have no answers. They can't give me anything. So I've seen about probably, I don't know, over 15 different doctors. I've seen general practitioners. I've seen a couple different rheumatologists, infectious disease doctors. I have seen, I saw a couple different ophthalmologists to look at my eyes. I have clogging of my meibomian glands. Luckily, I don't have atrophy of the glands, but I do have clogging. So yes, it's been affected that way. My vision's slightly worse, still pretty good. I have seen many different specialists, and most of them completely deny any possible late-term reaction from the drug. They just, oh yeah, you took isotretinoin. Oh yeah, and no, there's no way it could be affecting you now. You stopped taking it already, so it's out of your bloodstream, right? It's not in your body anymore, and no, it's not affecting you, and it must be something else. So this is universally what they say. So yeah, no, they have not really been helpful. At best, they've been, sincere and sympathetic, and at worst, they've been completely dismissive and giving me incorrect information about the mechanism of drug harm. So
I think the most helpful thing that a doctor ever said to me, and this was the doctor who prescribed the drug, after going back to him several times and then telling him that I thought I had a problem with certain foods and an issue with my digestive system, he told me, go and see a nutritionist.
Well, I'm glad that you said that. That's
Yeah, that's probably the
That's
most
probably the best
important
thing a
thing.
doctor could say, because doctors do not get any nutrition training in medical school. They just don't.
And then that
Maybe there's
nutritionist,
a few hours that they get, but
if it wasn't for that nutritionist, then yeah, I don't think I'd be as well as I am now, because she,
right.
first of all, she was the first person who actually believed my story.
Yeah.
Like, I spent 2 hours talking to her,
Yeah.
and that had a very sort of positive impact after,
Mm-hmm.
yeah, a good few years of people not believing my story, to be able to sit in front of a health
Right.
professional who actually believed what I was telling her. And she was already treating people who'd also taken Accutane, were
Common,
having loads
yeah,
of issues. So
common
it
theme.
was really interesting for her.
So actually on that topic, unless you have something else to say, I do want to mention two doctors who have listened to my story.
Okay, yeah, cool. Far away.
Yeah. So I went to see one of the head dermatologists at UCSF, a very well-known medical establishment. And he had had a lot of experience with isotretinoin. And I told him, so actually he was very nice doctor, and it really surprised me that he was actually willing to listen to my story. So I came to him very prepared in 2015, I think. He spent 2 hours listening to my whole story. And he was the first person who listened to me and who actually took interest in what I had to say. And he seemed like he believed me, or at least he did not deny what I was telling him like most doctors did. And so I came to him with pictures and, PubMed articles, and with hundreds of people's stories printed out on paper through internet blogs, because at this point in time it was really just internet blogs. So I presented him my entire story, and he was really shocked, and he said that he had never heard of anything like this before in his entire career, that it went against his entire board of dermatology training, and he never heard of anything that happened like this before. And yeah, and I told him, I'm like, well, there are actually hundreds, probably thousands, maybe millions of people suffering to some level of injury from this drug. I think as of 2011 there were like worldwide 20 million people prescribed. I don't know what the numbers are now, probably very high. um, so there are many people suffering from this drug. And I told him, I was like, why do doctors not recognize it? Why? And so, he didn't really have a good answer for me, but he said probably the most likely answer is just that when people get harmed by it, it's such a so the mechanism of harm is different than most pharmaceutical harm mechanisms, where it's like the typical drug reaction model that physicians learn in medical school is patient takes drug, patient has side effect, or adverse drug reaction, patient discontinues drug, and then adverse reaction goes away, or adverse reaction stays. This is the typical model for iatrogenic harm. The model of iatrogenic harm for things like fluoroquinolones and isotretinoin, things that affect the DNA, oxidize, damage the DNA, affect stem cells, affect mitochondria, is a very different model than what physicians are trained to recognize, because there's this delayed effect where you might, things pop up after you stop taking the drug, and doctors are not trained to recognize this. So he actually took interest in what I had to say, and together we proposed the possibility of me um, creating some kind of research paper that could be published, or some kind of survey that could be published. And he was interested in potentially calling it post retinoid syndrome, because there are syndromes for drug reactions, like post finasteride syndrome is a medically recognized condition. Fluoroquinolone associated disability is a medically recognized condition, but there isn't really a medical recognition for post retinoid or post isotretinoin syndrome. So we talked about that, and he said, well, maybe if one day you want to get something together, maybe we could work on this, and maybe I could present this at some national dermatology board, and we could look into why why patients are suffering and why people don't know, because in all of his decades of experience working as the top level board in dermatology, going to national conferences, I mean, this is a very prestigious physician. He had really never heard of anything that I was describing. It was like he was completely shocked. But, you know, with my position, since my father is a very well-respected physician and in the community, and because I had that connection, and because I seem to be well-spoken and I seem to be somewhat educated, he believed me to some degree. And I think if I had just come to him and been like, hey doctor, I got hurt by this drug, I don't think he would have listened to that. I had to have a very you know, a very convincing argument to share with him. And so I am thinking about perhaps one day working on this as a project. This is something that's in the works still. I've been communicating with a lot of people. So he's one of the physicians who listened to me, and the other physician who listened to me is the doctor who prescribed me the drug. So they're two people who actually, with me kicking and screaming and making a really big fuss and being a very squeaky wheel, finally came around to listening to what happened. And I think perhaps could be allies in the movement of advocacy, because I kind of twisted their arm into doing it, I guess, to some extent.
Probably a good time to say, if you're a medical professional or doctor watching this and you'd like to contact me,
Yeah.
get more information, perhaps work with us on this project, then yeah, please send me an email to lifeafteraccutane@gmail.com.
Yeah, we need to recruit all of the medical professionals and doctors as we possibly can to be allies of this.
Yeah, yeah. What are you doing currently to manage your ongoing issues?
Yeah, so let's see. What time are we at right now?
Don't worry about the time.
Okay.
Well, I can tell you, actually, it's probably getting quite late where you are, but it's like,
oh, I don't mind. It's fine.
8:35 a.m. here.
Sure. Okay.
Yeah.
So yeah, my current issues, what I am doing to manage them. So I started talking about diet. That was one of the first things I did when I first got out of the wonderful facility of learning how to knit and talk about my feelings while I became paralyzed. So yeah, I started to change my diet. I want to mention, by the way, that I had a very healthy diet before taking this drug. It's stupid that I even took it at all. I have a lot of shame about it. But I've never been someone who liked eating unhealthy food. Maybe when I was in elementary school, I ate some unhealthy food. And as soon as I went to college, I was really eating pretty healthy. So I have, you know, with the paleo diet, I think it's hard to tell if that really improved my symptoms at all. I was very strict with it. And I think if my issues had been more digestive, then it would have helped more. And I understand that there's a theory of leaky gut syndrome, and you know you have to heal your gut in order to heal the rest of your body. The issue that I have with that is that I have tried so many things to heal my gut, and my gut has always been in pretty perfect condition. It's just the musculoskeletal system that I have not really been able to manage, despite trying at least 6 or 7 different diets over the course of 5 years, each of them giving it a good between 5 to 8 months, perhaps around there. I can list the diets I've tried. So paleo, autoimmune diet, various different elimination diets, ketogenic diet that I tried. It's been a while since I've tried these things, but I was reading all of the books and all of the information and super diving into it. And I tried, I actually eventually transitioned into veganism. So that was a long experience. I went into at first just, you know, healthy cooked food veganism. And then that transitioned into, it was first like high fat, low carb, and then it transitioned into normal veganism. And then low fat, high carb veganism. And then I was slowly transitioning into raw veganism. And then I slowly transitioned into even more extreme versions of raw veganism. And then I actually started doing the Dr. Morse protocol because I kind of reached this level of desperation where I was trying that because I had heard that it had helped some people and it really hurt some people. So it's, you really try a lot of things. And ultimately in the alternative health community, there's so many things out there that you can try. And it's really just, some of them work with your body and some of them don't. And it's really just a trial and error. So, yeah, I even went vegetarian for a lot of months. I was carrying watermelons on a freezing cold mountain in Peru while being very weak. I was, very weak carrying up my watermelons so I could do watermelon fasting and in this remote village in Peru. And I was, drinking ayahuasca, trying to heal my emotions and my past karma and meditating. And, I was really hoping at this point, maybe it's in my head. Maybe if I heal my emotions, I will heal my physical pain. And then I realized that I have a Lyme bacteria as well, which for a very long time I thought was the number one cause of my after this whole dilemma. I thought, oh, well, maybe, I just got Lyme disease and then that's what happened to me and that's why I got so sick. The thing that I've learned about health and health conditions is that the body is not a binary system. We have this model of disease that is really not taking in the complexity of all the variables of toxicity in our lives, of pharmaceutical toxicity, of environmental toxicity, of genetic issues, of viral or bacterial infections. So I looked into a lot of different avenues for healing my health, and so there's a period of time where I was really approaching it from a perspective of trying to kill the Lyme bacteria that I thought was causing all my health problems. And I think I just wanted to have something that I could focus on eradicating from my body, right? Like I wanted to have hope that there was something in my body that I could kill off or eradicate or detoxify, and that at that point in time I would then heal. So I tried a lot of different things. For a couple years I was really pretty aggressively treating for the Lyme bacteria that I have in my body, perhaps dormant, perhaps active at this point in time. I'm not really sure. It could be either or. So I tried herbal protocols, I tried dietary protocols, I tried infrared saunas, detoxification methods, drinking ayahuasca, which was very helpful, by the way. I had a great experience with it. And I had various spiritual awakenings and experiences, and I learned the nature of reality. And, I had some good life lessons come out of this. And various different 7-day silent vipassanas where I'm sitting there in agonizing pain trying to be Buddhist and forgive. And
I think that was when we first spoke, actually, when you just done that.
yeah. I mean, the things that you'll do to heal your body physically, it's like you would go to any length to get better.
Yeah, exactly.
When you're not well, when your health is not there, you will do anything. You'll do
like
anything.
me
You
with
would cut
the
your arms off. You would cut your legs off.
well, like me with the fecal transplants that I've done.
Yeah, you'll put someone else's poop up your butt. You'll do
30 fecal
anything, right?
transplants. I remember somebody, I was in a Facebook group, and I started talking about the fecal transplants that I'd done, and somebody was saying, "Oh my God, that's disgusting. How can you do that?" Totally ignoring the fact that I went to a proper clinic to do it and paid a lot of money. But I said to them, "I'm so unwell, or I felt so unwell at the time. I would have drunk the stuff if
I mean,
if
you'll
somebody had told me that it would cure me." But the important thing I think that people need to know is that if you're dealing with some sort of chronic issue, be it Accutane damage or whatever, you have to take a holistic approach. It has to
Yes,
be
you
a
do.
completely holistic approach, you know.
Yeah. And never give up
Diet,
too. You
lifestyle,
can't give up
stress
even if
reduction.
things aren't working.
Yeah, exactly. Yeah, yeah. That's the most important thing. Maintaining hope. If you
Yeah.
remove hope, then that's it. You're screwed.
Even if your situation's kind of abysmal, you just have to like, and you know what I've been working on actually is I've come to some level of acceptance that the damage that's been done to my body is just pretty serious damage. And while I am on one level maintaining some degree of hope that my condition could heal and improve to some degree, what's actually really liberating is just to let go a little bit of this like grasping. And like I think for so many years I was just grasping to try to get back to what I was, and I have to get back to being like a high performing rock climber, and I want to go to medical school, and I want to change the world, and I want to do all this, I want to do that. And it's just like this grasping that kind of causes a level of anxiety and a level of tension in your nervous system, in your body. It just creates this really unpleasant stress when you're grasping on so bad to wanting to get better. And so what I've learned to do a little bit is just like, I guess I've come across I'm kind of experimenting with and dabbling in Taoism right now, and just kind of the fundamental aspects of just the, you know, the Tao of letting go, the Tao of accepting, of kind of dissolving your pain, of going with that which is, and you know, just understanding sometimes that shit happens, and just letting go of this grasping and this desire. And I think that the more I've let go of wanting the pain to go away, and the more I've let go of my attachment to wanting to be healthier, the more liberated I feel. It's like I get to this point where I'm just like, whatever, you know, like I am going to do everything in my power that I can to try to improve my health. And then once you reach that level that you know that you are trying to do everything you can, I eat a very healthy diet. I
What is your
do what I can.
what is your diet currently then? What are you
Currently,
mostly eating?
yeah. So after a very long roller coaster of lots of different diets, I've tried the lectin-free diet, the paleo diet, veganism, raw veganism, fruitarian, going back to eating meat again because I started to feel really, really, really sick and unwell after 3 years of being strict vegan. Um, and then, yeah, the lectin-free diet was the more current one. Right now, I have found that I really don't react badly to most foods. Like I've tried so many elimination diets, and I actually can handle eggs and dairy pretty well. I can handle meat pretty well. I wanted to think that I could not, so that I could eliminate it and see if that made a difference. It really didn't. Um, so right now I'm eating lots of fruits and vegetables. I eat those mostly raw as I can. I love berries. I eat lots of antioxidants, berries. I just, if it's not nutrient dense, I don't eat it basically. And I'm also not really eating nuts because I think those might be a little inflammatory perhaps. So, you know, I'm taking a lot of turmeric supplements. I'm taking some collagen, fruits, berries. I use eggs and meat sometimes as supplements. I use glandular formulas. So the glands from animals that are desiccated as a supplement. Um, I just try to, you know, have the most nutrient dense diet that I can. And if it's
Exactly.
empty, I don't eat it.
It seems to be
That's
the
pretty
most
much it.
one of the most important things to bear in mind if you're dealing with an illness is that your diet needs to be as nutrient dense as possible. And
Yeah.
you're not going to get that.
Yeah.
you
And I
know
felt,
you
yeah,
you know that I speak out quite a lot against veganism, and I just don't believe that a
right.
vegan diet has got enough nutrition to support
Yeah.
a healthy person, let
Perhaps.
alone an unhealthy person. Yeah.
Yeah. You know, my views on veganism are a little mixed. I've heard people gaining their health back through doing detox cleanses, and I don't deny the anecdotes or the experiences that I've heard of people healing from those diets. But I think that if you want to stretch that out into a long-term solution where you're being vegan for your entire life, I don't buy into the fact that that is what humans and primates are meant to do long-term. I think that for a short-term thing, until your fat-soluble vitamins run out, I think it can help some people, which is why I tried it. Right now, I just, I got to a point where I hit a wall with trying the vegan thing. And I think it was negatively affecting my health after 3 years, which, most people crash after about three to 5 years is when, the B12 and some of the other fat soluble vitamins run out.
I would say it's definitely detoxifying if you eat the right things.
Yes.
But if you go and if you do it and then you
don't be a junk food vegan, that will not help you at all.
Go and eat a whole load of wheat and sugar, then that's definitely not going to be helpful.
Yeah, I mean, if you want to be an ethical vegan and you don't care about your health, then eat whatever, eat vegan Oreos. But if you're trying to be healthy, then be smart about it. So
I would say if you want to do it short term to detoxify, then whole foods, plant-based would be the way to go, rather than vegan.
It's vegetable. I mean, I have heard of people recovering from serious conditions with a raw vegan diet, with juicing, with going fruitarian, with I believe those people. I also believe the people who say that they have healed with the paleo diet and that they've healed with the carnivore diet. I believe I say if it works for you, then do it. That's kind of my motto with diet, is that you just have to find what works for you.
For me, the carnivore diet is the most interesting at the moment. I see so many stories of anecdotal stories of people who've recovered from all kinds of illnesses.
I mean, taking fiber out of your diet, I guess, could give your gut a chance to rest.
It's really the ultimate elimination diet, but for me, I've tried it 3 times now for a month at a time, and my digestive system, my post-Accutane digestive system just can't handle it. I've spoken to a guy this morning who's trying it at the moment. He's been doing it for 2 weeks, and it's just
most people can't handle it.
Diarrhea.
I think like Frank Tufano is like he talks about Accutane and carnivore diet's the only thing he can do, and I mean, it works. I guess it works for him. He looks pretty healthy, so good for him.
He does a lot of raw carnivore, which I've not tried.
Raw carnivore, I know it's
so
a little gnarly.
I'm quite curious about that, actually. I'd like to, if I could find the courage to do it, I would I'd give it a go.
I don't know so much about that one. I don't know. I mean, I actually tried the carnivore thing for a couple weeks, and my body just said no more meat. I can't. It just wasn't right for me. I've done a lot of fasting. I'll tell you that. I did like an 11-day fat water fast, nothing else. I've done many short water fasts that are between 1 to 3 or 4 days long. I've done several juice fasts. I've done several dry fasts. Fasting is a regular part of my life. I do intermittent fasting right now, so I really only eat 1 to 2 meals a day. I think it's really just the best way to be in general. No matter what diet, I don't think it's healthy to eat all the time. I don't think humans are meant to just be eating like 5 meals a day or even 3 meals a day. I think unless you're super active, then maybe. But
fasting
I
has
don't eat more
definitely
than
helped
1 or
me,
2 times.
and I learned a lot by going to a fasting retreat in Thailand. But I'm the same as you. At the moment I'm eating 1 meal a day, and that seems to be enough for me. I keep myself in ketosis and I eat 1 meal a day, and that seems to be really helpful. Basically, I came to the conclusion that I know you don't have gut problems, but with me, I've got quite bad IBS, and less food in my system equals less IBS. So it's
great. Exactly. So
not rocket science, really. Okay, back to the questions. I think we've covered a lot of things already. What would be your advice to other people who are thinking about taking the drug?
It's a great drug. You should take it.
Yeah.
So, here's what I'm going to say about the drug. I believe that, as with all medical decisions or any decision that you make, the number one medical ethics piece that I would say that we need to value in every society is informed consent, right? So there have been multiple times in my life where I have been abused by the medical system, not given informed consent for various different surgeries or medications that I was given. By this, I'm not just talking about what the doctor tells you. I'm talking about what the medical establishment and community, what the medical boards tend to view on a certain medication, and about the specific details on the drug insert. So here's the thing with isotretinoin is that chances are, unless you have a very rare good doctor who is going to be really upfront and honest with you and tell you exactly what type of dangerous harm that you're getting yourself into, most of you will not be given informed consent about this medication, because I've talked to so many people who say the same thing about what their doctors tell them, about what the drug inserts tell them. And if you decide to take this medication, go into it knowing that you're playing Russian roulette. Don't go into it believing what your doctor tells you of, oh, the drug is safe. I would give it to my child. I would give it to my niece. I gave it to my wife. I gave it to myself. Nothing bad happens. I've never had anything bad happen. The side effects are rare and, no permanent sequelae. They just stop upon cessation of the drug. This is what they will tell you. This isn't true. Okay. A lot of us are working right now to spread awareness and raise awareness about the truth of this drug, because what your medical professionals tell you is not the full story and often is completely inaccurate and completely just an insane lie. So please, if they tell you not to get up Dr. Google and not to do your own research, get a different doctor. If they tell you that, tell them that you have every right to do your own research. This isn't just an issue with Accutane. This is an issue with every pharmaceutical out there. It just happens to be particularly bad with this drug. So please do your own research. That means look on Facebook, read stories of people who've been harmed by the drug, believe what they say, because we're not out here making it up. We have no reason to be, pretending like our lives have been ruined. That would be ridiculous. Please believe people when they say that they've been hurt by the drug. Understand what you're getting yourself into. Understand the mechanism of how this substance works. It damages your DNA. So if you decide that your acne is so bad that you would willingly ingest a chemotherapeutic agent that changes the way that your body works and that might have effects that pop up months or years after you discontinue it. And if you think that you are just at this level of hating your acne so much that you're willing to possibly ruin your body, then I have nothing to tell you. Go for it. If that's where you're at in life, then you couldn't say that you've been warned. If you're not at that point in life, which I'm hoping most of you will not be, then please never even just go out of your dermatologist's office. Just don't even go to them unless maybe you're getting some kind of light treatment or laser treatment. Just please do yourself a favor and don't ever step foot in a dermatology office, because there are so many harmful drugs that field prescribes for innocuous like skin conditions. So please don't go to your doctor,
and definitely fully research the alternatives to this drug. Like we said before, a holistic approach: diet, lifestyle, stress reduction, that kind of thing. You can find there's numerous accounts of people online who've had severe skin problems, acne, eczema, and they've managed to clear them with a more holistic approach.
And I think this is exactly. And I think this is a good place for me to talk about I don't know, Tom, do we have time to talk about some of like I meant to talk about this in the beginning and then I
There's
didn't.
no time limit. Just
Okay, sure, sure.
keep
Well,
talking. Yeah.
um oh man. So this is a good time for me to talk about what led me to taking this medication in the first place.
Yeah.
Um
Okay.
I guess the stage of life that I was in at that point in time. So like I mentioned before, I come from a medical oriented community of people in school and in my family. So I have been kind of brainwashed into this paradigm of medicine, of believing that the risks that you take with the risks that you take with medication is so low that it's pretty much almost never happens that you have a drug reaction because it's so insanely low. And this is a lie that is really prevalent in the medical community. So when I went into this is something that I really wanted to talk about in the beginning, is that when I went into my doctor's office, I did not want to take Accutane at all. I did not want it. I went in because my father um, saw that I had been struggling with my acne, and I told him that I was trying a lot of different holistic approaches to managing it. And so, I told him that I was researching the low glycemic index diet. At that point in time, I had been experimenting with diet a lot, actually, and I was doing low glycemic index and cutting out everything that I thought might be affecting it, and trying to manage my stress and doing yoga, and I was exercising a lot, and I was trying to get fresh air. So I was actually really, really on the path of waking up to holistic healthcare. And it was actually my father who discouraged me from that path, which is really sad and really tragic and really unfortunate that someone's own father would discourage them from a healthy lifestyle. But, he was just doing what he could in his paradigm to try to help me. And with his understanding, he thought that, the medical basis of research is that diet is not affected, diet doesn't affect acne. And this is just a bunch of BS that doctors say. And we know it's not true. And I knew in my intuition, I knew it wasn't true. And that's why I was trying to manage it on my own. But eventually, I got really frustrated with the fact that it felt like none of the diets I was doing was really working to manage my condition. And so I got really self-conscious and really frustrated, and it's really emotionally challenging to have like big cysts on your forehead, and it made me not want to leave the house. And yeah, it affected me emotionally. So I went to the doctor who works in the same office as my father upon my father's recommendation to see him. And when I saw him, I thought that he was a trustworthy person, and he wouldn't hurt me, and he and my dad share an office together, and it has to be somewhat safe, right? And so I thought that he would just give me maybe like a laser treatment, or maybe he would prescribe me doxycycline, or again, like I had already taken it before, and it worked, and then my acne came back. And then I had tried minocycline, doxycycline, Bactrim slash sulfa drug, a couple other tetracyclines. I tried a couple different birth controls. I tried spironolactone. Um, I tried various different topicals, including antibiotic topical and retinoid topical. So I really just thought maybe he'd give me another antibiotic, but then he suggested I go on low dose Accutane. So
Not to open another can of worms here, but all of those other drugs can cause problems too. I've spoken to
right,
people who've had liver damage from doxycycline,
yeah,
and obviously with the things I've learned about gut health over the years, every one of those antibiotics that you take long term will be affecting your gut flora as well. So they're killing off your
yeah, sure,
gut flora.
yeah,
I think that is another big issue with people that take Accutane. They're weakening their immune system
So I did not just jump straight into Accutane. I did not even want to take Accutane. I had heard of things about it online, and I didn't want to do it. So I was really, at this point in time, I was age 21, and I was wanting to dive into the holistic realm. But diving into the holistic realm when you are the daughter of a medical family is kind of a rebellious act. And so upon embarking up on that rebellious act, I received a lot of, I guess, dismissal and discouragement from my family. And I tried to talk about it with them, and, tried to say, well, I want to try this, and I want to try this diet, and maybe I can look into this thing and this treatment. And I think the biggest mistake I made was talking to my dad about it, because I really wish I had more confidence in myself for treating this very not serious medical condition. I thought because he was a doctor that he would be able to help me with my health and help me figure out how to manage it. And I trusted him with my life. He's my father, and so trusting him, I thought that it would be beneficial for me to go to him for advice. And so I was really discouraged from doing anything holistic or alternative. I was discouraged from doing any acupuncture or doing diets. My dad said in an email, he quoted, Rachel, you should stop looking into your diet. It's too small of a factor. There's no scientific proof that this even changes anything. You're just being obsessive. I think my parents said that I was being orthorexic, that it was being unhealthy to be so obsessive over my diet. That they just kind of told me you're being ridiculous, it doesn't make any difference, you should just just go see a doctor. They were really discouraging me from it. So I highly recommend that if your family has that kind of influence on you, just to stay certain and clear in your own path, and don't let anybody, including people who you trust, including your family, your husband, your wife, your father, anyone, don't let anyone tell you that you need to go to a doctor to treat your acne. Even if you trust them with your life, don't allow them to convince you that this is something that you need to do, because you don't. There are so many things that you can do, and so many things that I did do before going to the doctor. And I think I wish that I had just you know not really worried about my acne so much. I wish I had just kind of continued to try to do things that I thought might help, and kind of try various different diets, and if it doesn't work, then just continuously avoid doctors. Robert Mendelsohn, he writes I think a book on Confessions of a Medical Heretic or something like that, and he says that if 90% of modern medicine were to just disappear off of the face of the earth, he was warning people about not going to your doctor back in the 80s, and nobody really listened to him. So the best thing you can do for your health is just to not go to a doctor unless you are really sick in an emergency type of situation. And if they try to push drugs on you, don't take them unless you really, really, really need them, because the risks of the medications are inaccurate, to put it simply. So
The quick fix is rarely the right path to take. I've learned that
yeah,
the hard way.
physicians don't actually have a very good understanding of health. That's the thing, is that physicians have a model of disease. So they talk about disease in terms of just a cluster of symptoms, a cluster of things that are wrong with the body. And so I think the founder of osteopathy, his name is A.T. Still. Osteopathy is a type of medicine practiced in America that's a little more holistic. He talks about how I think he says something like, any fool can find disease, but it takes a true doctor to be able to find health and wellness. And unfortunately, our medical system doesn't look for health. They look for fabricated and manufactured diseases, some of which don't even really exist. Like acne is not really a disease. Acne is an inflammatory condition of the skin that is a result of various different stressors that could happen in your life or in your body, of a sign that you're not really at full health. And perhaps it could be toxins leaving your body, perhaps it could be inflammation,
Hormonal,
an incorrect diet,
bacterial.
environmental issues, lack of sunlight, just lack of pure health.
There's a
So
guy. There's a guy that I've been made aware of. Actually, I might link his YouTube channel in the description. Um, there's a guy called Rob Stewart who's got a YouTube channel and an Instagram account, and he had very severe skin issues, acne, eczema, all kinds of problems, and he's cleared it up with diet and lifestyle.
yeah,
And
sure,
he
it's
shares his
not hard to
story.
do.
Yeah. And
Yeah,
there's a website called goodglow.co.
yeah,
I'll put the link to that in the description as well for anybody who is interested.
yeah. So I mean, that's the thing, is that it's not a rocket science to to improve your skin. It might take some time, it might take a lot of trial and error, and maybe you're never going to fully get rid of your acne completely, because it's normal to have a little bit of acne. It might be due to a situation that you're not even in control of, like environmental pollution. Maybe you're going to have acne unless you move to a different location, unless you get more sunlight, unless you change your job, unless you change your relationships. um, Holistic health is such a large um it's such a broad perspective of looking at the body, that you're not looking at specific inflammatory markers. You're looking at your whole body as an organism. So I think that if you're struggling with acne, um please do not allow your doctor to convince you that it's a disease, because it's not a disease. Okay. They manufacture this concept that acne is a disease in order to sell you medications, and in order to sell you into this belief system that you should feel bad about yourself, that you should feel as if you're diseased, and you're not. It's a symptom of some aspect of your lifestyle that is not in alignment with pure health. And it's not something to be ashamed of. It's not something to feel bad about. And sometimes it's not completely in your control either. And just let go a little bit. Just let go of the control that you have, and realize that nothing is as important as your health. And if a doctor tries to tell you that their medication that they're giving you is safe, even if they choose to give it to their own child, chances are they are completely unaware of how the drug works and how it can affect you negatively, because in my experience, they really don't know.
I was just thinking, actually, if you want confirmation of how little doctors know about true health, or how confused they are about it, go to several different doctors and ask them the same question. What do I need to
Right.
do? What do I need to do to be healthy? And
They won't be able to give you an answer. I
see what
mean,
answer you get. Yeah.
yeah, if you say, what can I, if you, if you were the question, what can I do to not have this disease? And then you like create, a disease of like, oh, I have acne. Acne is a disease. What can I do to not have this disease? Then they'll be able to prescribe you medication. If you word it slightly differently, of what can I do to improve my health so that I don't have acne, then they're probably just going to look around and be like, I don't know, what do you mean improve your health? So you don't like, what do you like? I don't know. I can give you this
Well,
drug to treat this disease, because they have it completely backwards. They go through 4 years of undergraduate, and then 4 years of medical training, and then 3 years of residency. And they are just so stuck in the forest that they can't see the trees. And they are just brainwashed, intelligent retards who really, like, I say that lovingly because I have doctors in my family, but they're so intellectual and so mechanistic and so trained and indoctrinated that they actually have lost the ability to truly think and to truly, there are some exceptions out there. There are good doctors, but I'm talking about, you know, like 90% of them, maybe more, are not.
Well, actually, most of the people that have helped me in the aftermath, the people that share free content online, are doctors, but they're doctors who
Within the holistic health community,
or the
perhaps.
functional practitioners, and most of them
Right.
are doctors that have become ill themselves.
Yeah.
And then they realize that the conventional,
The model doesn't work.
Yeah, exactly. The conventional system that they learned within has no answers for their chronic health issue, and then they have to think outside the box.
I like to think of conventional medicine as a dangerous cult that I have been excommunicated from, or that I have left. I think of it as a sacrificial cult of dangerous disease mongering misinformation that, unless you really have an emergency, and, you know, God bless emergency room doctors for saving people's lives, and God bless neurosurgeons for performing incredibly precise surgeries. But beyond that, I mean, a lot of doctors are really just, they don't have a clue what's going on. So be aware of that. Like, be aware. Dr. Mendelsohn warned people back in the 80s to not allow yourself to be harmed by doctors, because if you allow yourself to go to the doctor and if you follow all the advice that they give you, then you're putting yourself at great risk of getting harmed. Like, if you have a urinary tract infection that's, you know, relatively minor and not life-threatening, and you go to a doctor and they give you Cipro, you could end up in a wheelchair for your life. So, you know, it's just, you have to be aware of these things. They don't warn you about these risks. Actually, the same doctor who prescribed me Accutane prescribed the person I was dating at the time. Complete coincidence, actually. He went to the same dermatologist because he's so well regarded in my community as being a top level dermatologist. He prescribed him ciprofloxacin, which is a fluoroquinolone antibiotic, for for atopic dermatitis on his face that was completely not bacterial in origin at all. Non-bacterial infection that was, or sorry, not infection, non-bacterial skin condition that was contraindicated for his condition, basically an aneurysm and a major surgery for it. So fluoroquinolones are not meant to be given for that, and they're also meant to be last resort drugs. So he was given one of the most dangerous drugs on the market for a non-bacterial infection. So this is another warning. Just please think before you go to your doctor. Like, they don't have your health in mind. They really just don't think sometimes. They're not trying to hurt you. They're just kind of brainwashed. So
yeah,
patience beware.
Let's get on to our last couple of questions and bring this long video to a close.
Sure.
But thank you to anybody who's listened to the whole thing. And
yeah, I can edit some of it out if you want.
No, it's fine. We'll leave it in. We'll leave most of it in, I think. Okay, so do you think the drug should be banned?
So here's the thing. Should the drug be banned? I think yeah, I would love to see the day that this drug is banned, because no chemotherapy drug should ever be used to treat a skin condition that's not life-threatening. But I don't think that's realistic. I think that in the free world that we're in, people want to kill themselves over long periods of time with dangerous substances. They have the right to have informed consent to do that if they want to do that. So if you really want to poison yourself to get rid of your acne, and you are at an age where you are able to make that decision in an informed way, then you have the right to do that. I'm not here to tell someone who is fully informed about, you know, the risk of this drug to not play the Russian roulette game of taking it. But just know that your risk of getting hurt is not 1 in 10,000. It's not 1 in a million. It's not even 1 in 1,000. my estimates are that your risk of getting hurt are to various different levels. One scientific paper says 1 in about 7% of people get hurt. I think it's a little closer to maybe, I think it's a little higher than that. I think maybe 1 in 10 people, maybe more. So just know that the odds are not great, and that, I don't, maybe one day it'll get banned, maybe it won't. I don't really care if it gets banned. I just want an FDA black box warning and signed informed consent. This drug can cause serious long-term glandular, central nervous system, musculoskeletal damage that starts after you discontinue the drug, and it can last indefinitely. We have those warnings for fluoroquinolones, but we don't have those warnings for this drug. So that's what I want.
I would say from what I've seen, just going by what I see in the Facebook groups, there's a Facebook group that's called Accutane Survivors, Accutane Injuries and Side Effects. There's nearly 8,000 members in that group. And I would say from the posts that I see, probably somewhere in the region of 30% of the posts are written by people who've had a negative experience and have come off the drug and they're still experiencing problems. That's just a rough estimate.
Some of them decades. Some of them are suffering for decades and in suicidal pain.
Yeah.
People want to, take their eyeballs out because they're in so much pain.
Yeah.
It's really horrible what this drug can do. It really damages your body very seriously.
Just trying to end on a positive note. What are your hopes for the future for yourself?
For myself, I want to, there's a few protocols that I want to try doing that might hopefully decrease my pain levels so that I can be more mobile. I'm in so much pain that I can't really walk a whole lot. So I'd like to be able to walk more. I would like to be in pain levels that are less than, my pain levels are 6 to 9 out of 10. I would like that to go down to below 5. That would be great if that could happen. I would like to improve my brain fog so that I'm a little bit more cognitively functional. My brain function and my IQ has improved over the years slightly, but it's still impaired. Not as it used to be. And I guess on a note of, making sense and making meaning out of all of this, I would like to work on a project that I'm hoping to do, which is to write a book on post-retinoid syndrome. And it's one of the hidden epidemics. And so really just to continue exposing all of this misinformation, because at this point, I think I know more about retinoids than most dermatologists who prescribe the drug. I've read hundreds of papers, scientific papers on it, and I know a lot about this topic. So I want to continue the activism work. I'd like to get black box warnings put on the drug label. I want to make some kind of difference so that people, young people, are not taken advantage of in the same way that I was, and not harmed in the same way that I was. And yeah, for my future, I hope for improved health, improved happiness, and improved spiritual lessons from this. So, diving more into Taoism again, and just trying to find the happiness and the connections despite the levels of pain that I have that sometimes keep me quite disabled.
Okay, well, thank you for coming on for an interview. Really appreciate it. And I know it's taken quite a lot of courage for you to come out and tell your story. I'm sure everybody that watches this will really appreciate the effort that you've made.
Yeah, it's a long interview, and maybe I'll do more on outing some of the things the doctors say about the drug that are not true. So
if you've watched this video and it resonates with you, then please subscribe to the channel. And again, just to remind you, please give it a thumbs up. The more people like the video, the more likely it is that people are going to see it. If you'd like to donate to the cause, if you can head to my Patreon page, which is patreon.com/ lifeafteraccutane. If you'd like to come on for an interview, please email me at lifeafteraccutane@gmail.com. I am also a certified primal health coach. If you'd just like to be coached with your sort of general health issues, you can find me at theprimalnutritionist@gmail.com, or you can follow my Facebook page, which is facebook.com/theprimalnutritionist. Again, I should probably mention the Accutane groups on Facebook. Long-term as Accutane long-term side effects, and Accutane survivors, Accutane injuries, and Accutane side effects. I think that's all I need to say. And yeah, thanks again, and have a good day, everybody.